Hello, my name is Motooka-Halseth. I'm a nurse. This is a birth control presentation for MSN 562 CSU Dominguez Hills for FNP program. Everyone has different perspective on what is important regarding to the birth control. There are many ways to prevent women from getting pregnant. I will explain the pros and cons of each method as I go. At the end of the presentation, I will share with you the resources and websites that are useful in learning more about birth control methods so that you can go and learn more about them. So the first one, I like to talk first about the method that doesn't require any kind of equipment. Um, and I will like to talk to you about the efficacy or like the effectiveness of the methods. Abstinence will not require any special equipment, but you will have to have a lot of willpower and good communication skills with your partner. If you do have a sexual contact through oral or anal sex, you will have to use another barrier method to protect you from STD. And even though you do not penetrate, but if you are touching each other with your genital, then you will also have to protect you from STD. So barrier method is recommended. So next one is called fertility awareness method. Um, it is also called rhythm method or natural family planning method. Um, it is practiced by knowing fertile period using dates and body temperature and cervical discharge to know female's reproductive cycle. Um, when it's practiced correctly, it is 76 to 88% effective. However, it might not be as effective in women who has irregular cycles. Um, and another con about this is that you will not be able to have sex during certain period of the month. It does not offer any STD protection either. So next one will be lactation amenorrhea method. Um, it is practice that so when women give birth and when she's breastfeeding the baby, it naturally suppresses fertility by not ovulating. Um, so it is only effective for the first 6 months after delivery. And it has to be done in a certain way. The breastfeeding has to be done in a certain way that feeding baby every 4 hours during the day and 6 hours at night. And then breast pump does not work. It has to be actual baby that is on the breast and drinking milk. And you will not or the woman will not get a period if this method is working correctly. If she is already having period bleeding, then she has to use any backup method because she is in the cycle already. Another method is called withdrawal. It's also called pull out method. Um, and this method works that before men ejaculate, he pulls out of vagina, and the idea is that there is no ejaculation, so there is no semen in vagina, and thus preventing from getting pregnant. Um, However, females do not have the total control of this situation. And then also there is a discharge before the ejaculation that contains the sperms. Um, so she could also get pregnant from that. Effectiveness is 78%. There is no protection against STD in this method. And then it can go, it can be missed. So this is not a great primary um, birth control method, but it is out there. So next one is moving on to barrier method. The most famous one being condoms. Male condoms are effective 82 to 98%, and female condom, which is less known, is effective about 79%. You can see the picture on the right hand downside. That's how it's applied. How it's used and put in. Frequency of use, you have to use it every single time that you have sex. And it is a good protection against STD. It separates mucous membrane of one person to the other. And it does not require prescription. The cost is fairly low as well. So there are other variant method as well. These three are used by females. Diaphragm, which is on the top one, it is 88% effective. Cervical cap, which is smaller, it just covers the cervix, 71 to 86% effective. Sponge, which is about 76 to 88% effective. These three do not protect um, against STD, and you have to use it every time you have sex. And some of them require fitting and prescription, and they're often used with spermicide. So here's the spermicide. It comes in many different forms and shapes. It can come in gel, cream, lube, or film, or suppositories. They kill sperms. It is about 78% effective. It does not protect you from STD. It is best used with barrier method. It is more effective together, and no prescriptions needed for these. Some people who are really sensitive might have some kind of reaction or rawness from the material, depending on the brand. But they are there, and it you can buy them over the counter. Now, moving on to hormonal contraceptions. Before I go to each individual ones, I wanted to tell you about the main how hormones work to prevent pregnancies, and then also the common side effects of them. Um, and all home contraception, all birth control method that has hormones work in a similar manner. Some of them have both estrogen and progestin. um, some of them have just progestin only. um, they suppress ovulation, meaning it suppress it. It helps the body not to ovulate, to have the egg mature and then pop out from the ovary. That way, um, it does not meet the sperm. Some make cervix thick with mucus that sperms have difficult time entering. Um, Side effects are nausea. Common side effects are nausea, mood changes, headache, skin changes, including less or more acne, um, and also missed periods, no periods, or lighter period. Some people experience weight gain. Some people experience sore breasts. Smokers, people who had a cancer, or people who has high blood pressure may not be a good candidate for hormonal methods. So talk to your doctor to see if you are a good candidate for hormonal method. So the pills. Pills are pills that you take every day. And some of them has both estrogen and progestin. Some of them have just progestin only. It is 91% effective. It can regulate the periods, and then it can make your period lighter, more regular, or skip it altogether. Daily dosing is required though, so you have to take it every day for that to be effective. Next one is called NuvaRing. It has both estrogen and progestin. It's a small plastic ring that's flexible, that females would insert into the vagina. It is 91% effective. And then good thing about this method is that you don't have to change it for 3 weeks. You keep it in there for 3 weeks, and then you take it out for 1 week, and then you repeat the cycle again. But it is very low maintenance. You do need a prescription for this, but it is very low maintenance and it's easy to use. Next one is a patch. It is a band-aid material, a kind of thicker band-aid type of material, a small patch that you will put into your to female skin. It has both estrogen and progestin, and it is 91% effective. And then the women have to change it weekly for that to be effective. Um, you can wear any part of your body except for the breasts. Um, and then you can keep it in the area that people can't see, which is nice. So next one is injection. It's called Depo-Provera. Some people call it Depo shot. It has progestin. It is 94% effective. And then women will get it every 3 months, one injection. It requires office visits, and of course the injection is involved, so you have to be okay with the poke. Um, and then some women reports weight gain on this method, but some people really like it because you don't have to think about anything in 3 months. So next one is called moving on to more of long-term method. It's called implant. Nexplanon is a well-known brand of it. It is a small progestin rod inserted into the upper arm, right under the skin. It is reversible. It is good for 3 to 4 years, and it is 99% effective. So it is very effective. And putting the implant in will be done in the office as a procedure. Um, so they will inject lidocaine. That way, it will not hurt. And then also when they take it out, they inject with lidocaine and then take it out. And it is a rather quick office visit. But it involves doctor's office visit. Frequent side effects that's reported with this is frequent spotting or frequent bleeding. But some people really like it because it is visible. You can touch it and feel it. And it's kind of easy to monitor that it's there and it's working. Moving on to IUD, intrauterine device. There are two big group of it. One is hormonal, and the other one is non-hormonal. Hormonal one, Mirena, Skyla, for example. Mirena is good for 5 years. Skyla is good for 3 years. That has progestin. It sits in the uterus. And then um, it, it, um, it also suppressed the ovulation. Um, it also thins the lining of the uterus. And also thickens the mucus of the cervix. So the sperm has a hard time entering the uterus. Non-hormonal one, the copper IUD called Paragard, which is good for 10 years. It the copper kills the sperm, and then also it gives the uterus the hostile environment for the eggs to be able to reach there and then get fertilized. So it doesn't work it as it works is as different ways from the hormonal implant, um, but it still sits in the uterus just like the Mirena and Skyla. So after insertion, after putting the IUD in the uterus, there is no further maintenance other than pulling it out when it's due to when that expires. Um, One thing is that you have to go to healthcare facility to get it placed. Um, and it increases the risk of ectopic pregnancy, and also the copper IUD Paragard, it may increase the menstrual flow, so you might have heavier bleeding, more cramping, heavier bleeding with the Paragard. Um, Both all the IUDs that will get placed in the uterus comes with a risk um, of pain and an infection, and then also they can damage the uterus as well, and then that's one of the risk. But for people who wants long term contraceptive, um, and does not want to use anything else in between, it is a good way, um, because once it's in there, it will stay in there and it'll work. So, when a couple is done having children, sterilization is a great method. This is not a reversible method, so they will have to be sure that they do not want any more biological children. Um, Tubal ligation is a female procedure, and it can be done after C-section, or if woman does not have C-section, and she can get it without opening her tummy up. They can go through small holes to do it. And men can go through a procedure called vasectomy, which is very simple, same day procedure, outpatient. They can do it same day. Um, and they will make a small puncture hole, and then they will snip the tube. Um, and both of the procedures are very effective, and it is effective more than 99%. um, and so one thing is that it is permanent and you cannot reverse it. So, I wanted to talk about emergency contraceptions. They are also known as morning after pill. Ella and Plan B one step is most well known ones. Plan B one step is available with a prescription, but can cost up to $50. I think I checked it today. Amazon, it was 34. Um, So when accidents happen, such as when pull-out method doesn't work or condoms break, or a scary situation such as rape happens, emergency contraceptions can protect women from getting pregnant. It is effective if taken up to 5 days from the time of unprotected sex, but it is more effective if it's taken sooner. It works um, in a way that it prevents ovulation. So it is not, let me see. It is not an abortion, but it just suppresses ovulation so that the eggs won't meet the sperm. Copper IUD Paragard can be used as emergency contraception up to 5 days after the unprotected sex, and it will keep working. You can keep the Paragard, and then you can keep it for 10 years after that. So, emergency contraception should not be your routine birth control method. It's a good thing to have it just in case, but you shouldn't be using it very often. If you're using it more often, then you should think about what will changing your primary method of what the basic method, for example, changing from um, a pull-out method to pills or pull-out method to something a little bit more um, effective. So knowledge is power. It is so important to know your birth control methods so that you have the control um, over your body. Those websites that's listed on there, Planned Parenthood, Bedsider, Family Pack, um, are great in providing clear and easy to understand information about your birth control or your partner's birth control. I recommend discussing it with your partner to see which method works for both of you. The birth control program called FPAC, the Family Pact, is widely available in California for low income families and students. It covers up to 200% of poverty line, um, and most of the method that I talked about in this presentation is covered. So please go and check it out. And most of the insurance companies birth control is included in the plans as what's called formularies, or like any preventative services, it should be covered. So go take a look and see what is covered. Make yourself more knowledgeable about what's available to you. That way you can use them as needed. And this is my reference for the presentation. Thank you for listening. Bye.